Welcome to the Java Cafe, Java fam.
For the innovators, the dreamers, the risk takers, independent workers who keep our neighborhoods thriving, Connector Care from the Massachusetts Health Connector has plans for every lifestyle and budget.
Having access to affordable healthcare is for everyone in our community.
Connector Care plans help more people save on healthcare that covers all their needs. Find out if you qualify for Connector Care. Visit mahealthconnector.org or call 1-877-MA-ENROLL.
Good morning. Welcome to the Java Cafe, Java fam.
Good morning, everybody. Good morning. Good morning. Today is Monday, December 11th, 2023, and I'm smiling because I have part of the team of the producers from the Mass Health Connector. We're going to talk about health insurance this morning, and it's just interesting seeing Jason in the background. He smiled at the commercial, and I'm sitting here smiling as well. Listen, for the next 25 minutes, half an hour or so, we're going to talk with Jason. He is not a stranger to the Java Cafe at all. Actually, when the team reached out to say, hey, we want to talk about open season. We're also going to talk about redetermination this morning as well, and he'll explain what that is. I said, I'm going to be perfectly honest. This is an authentic space. I gave the brother a whole new name. It was Jeff Landers. And so ASG was like, wait, who, what? And so let's go ahead and bring Jason in the room this morning. This is my buddy. I love conversing with him. Just in general, our first episode was about the importance of health equity and whatnot. We actually talked behind scenes, and I'm like, okay, I really like this brother. And so Jason, not Jeff, the email thread was hilarious. Stephanie was like, I'm not sure who that is, but do you mean Jason? I was like, yes. I did it like off of just memory, and I gave you a whole new name. I at least had the initials right.
Well, thanks for having me, Jalen.
Oh
yeah,
that was good. That actually needs to be a clip. Payback.
I get Jeff all the time. Don't worry about it.
Okay. All right.
And you know what? We can just end it now and just run that ad a bunch of times because you nailed it. And
come on, man.
We're good.
Well, speaking of nailing it, just a little bit. I moved in the apartment less than 24 hours where I am now. Before that happened. And it was the team. They were very patient. Everything in here got switched around and whatnot. So thank you for that opportunity as well. But I thought it was so important, and I was humbled because we're going to talk about overall open season redetermination. But one of the things that commercial highlights is the Mass Health Connector, Mass Health, and the state has an option for this sort of a rising workforce industry, 1099ers, entrepreneurs. And so if you would like, first of all, let me back up. How are you? How are things
great.
going?
How are you?
I'm doing good. I'm doing well. I just want to
kind of a dreary Monday, but let's brighten things up a little bit here.
Absolutely. Absolutely. So let's talk about, for our entrepreneurs, let's talk about this new option for 1099ers.
Sure. So we've always had what we call Connector Care. Since the Health Connector was created, we've had subsidized options for people that have lower monthly premiums, lower co-pays, and no deductible, right? Like that extra $2,000 you got to pay, or $3,000 or whatever it is, like that's off the table. This year, for plans going into 2024 for the first time, we've expanded the income eligibility there up to 500% of the federal poverty level. But what that means really is if you're an individual making $72,900 a year, or if you're a family of four making $150,000 a year, you are now eligible to get into Connector Care. So you can come in, depending on where you are on the income scale from there. Premiums are as low as, I think, $219 if you're just over that 300% of the federal poverty level. I think it's $250 if you're higher up. But the lowest cost silver plan in Boston's $430,
For the year?
$440 per month.
Per month.
So you're taking that 430, 440, and we're knocking it down to 220, 250. Copays are generally, $15, $20 for just about everything. Prescription prices are lower. And like I said, that deductible is gone. So you get rid of the deductible, you cut your premiums in half-ish, you're looking at saving $4,000 a year if you're going to the doctor on the regular and taking care of yourself.
It's it's actually more than 4,000 a year, because one of the reasons that in Massachusetts was a leader in, everybody getting insured is that on the back end, routine and preventative care. So that's one of the goals also of Mass Health Connector. The other piece that we wanted to talk about, and we'll go and review this, I'm going to bring up the website and just go a couple of places, is redetermination. And Jason educated me today. I was thinking of one date for something else, but can we explain what redetermination is? It is based off of some leniency or some special allowances that were happening during COVID. COVID is dissipating. However, we still need insurance. And this has been going on, you said, since April?
Correct. So
federal.
During COVID, if you got into Mass Health, if you got into Medicaid during COVID, you got to stay in Mass Health no matter what happened.
Okay.
And traditionally, you might get into Mass Health, and then 6 months later, you might get a new job. You might start making more money. And Mass Health says you're no longer eligible. You have to go get health insurance somewhere else. But everyone got to stay. And so in April, Mass Health had 2.4 million people who were members in Mass Health. And over the course of a year, they have to look at every single one of those people and determine whether or not they should stay in Mass Health or not.
Okay.
And for those people who are moving out, they can come to the Health Connector. And same opportunities are at the Health Connector, right? You can come in, you can get subsidized coverage, you can get into the new Connector Care plans now. Because look, at the end of the day, we want everyone to have health insurance.
Yeah.
And we understand that a lot of people who have been in Mass Health for the last few years may have gotten a job that provides some health insurance and they don't need us. That's cool. But there are a lot of people who are going to need health insurance now, and we want to make sure people know that we're available for them.
Okay. And can I ask this? This is something that, if I'm right, you were on once before. It's kind of, the options have kind of always been available, but is it just that the intentionality of the Health Connector is making sure that people that are going through this transition understand that this has always been an option, but there's more attention now because people may be like, a lot of things changed during, COVID with insurance and whatnot.
Right. So there are people who they've been on Mass Health since the middle of 2020. Right. And now suddenly 3.5, almost 4 years later, they're being told, not anymore. You have to go find something else. So yes, we have been, talking to those people. We send them probably more email and phone calls than they'd like, saying, hey, don't forget, you got to get health insurance. And Mass Health and Healthcare for All have also been great. They've been in 15 communities around the state, plus a few more, really banging the drum, getting people to update their information. Maybe they can stay in Mass Health, and if they're moving, to come to the Health Connector.
Okay. There's actually I don't know if we've done this, but I think we did once. There's actually a question from Naraki, who is in southern toward Rhode Island, that area. She'll get me later. Can we explain the Tufts and Harvard Pilgrim merger? Now, this is not any impact as it relates to Mass Health. Naraki, he cannot speak to that merger. He's at Mass Health Connector, but is there any impact, because there have been mergers, people are consolidating and things like that? Is there any impact if you have Mass Health?
Not really. Tufts and Harvard Pilgrim started their merger a few years ago. They have slightly different provider groups. I think Harvard has kind of a little bit of a larger provider group. Up until through this year, Tufts was one of the carriers that we had in Connector Care.
Okay.
But starting for 2024, all of our carriers are going to be available on Connector Care, including Harvard. So Harvard, Blue Cross, and United are all new to Connector Care for 2024.
So, and I've been transparent with the audience before and whatnot. Some time on unemployment, time on Mass Health. You're not just limited. Sometimes there's an air that, if you're on Mass Health or state, you're limited to certain. So you're limited rather to certain sort of coverage. You actually, the determination is made that you can get into Mass Health, and then based on your income, they offer you options for other types of. So it's through Mass Health, but your insurer or underwriter, if you will, is a United,
The commercial carrier,
the
correct?
commercial carrier.
Yeah, and not everyone comes in at the same premium. And even in Connector Care, some carriers cost more than others, and we do see people kind of naturally gravitate towards the lower cost carrier for
Okay.
obvious reasons.
Yes.
Look, if you look, if the doctor that you want is in a lower cost plan, there's no reason not to go with the lower cost plan. As long as you can go see your doctor, all the benefits, all the coverage is pretty much the same. So save some money, see the doctor that you've been going to forever, and you're all set.
Okay. That the redetermination, thank you for the explanation of that, because it's the holidays. People are really looking at a lot of things. But one of the main things that we have not said it clearly, you have until when, Jason?
So outside of redetermination, right now is open enrollment. So anybody who doesn't have health insurance can get in the door now. If you want to start coverage for January 1st, the deadline is next Saturday, the 23rd. And my special advice maybe for people watching is do it this week. Look,
Just to make sure it's done.
just to make sure it's done. And, I think, let's be honest here, right? Healthcare, picking a health plan can be confusing, challenging. Some people get nervous about it. But if you go in now and you take a look and you have some questions, you can give us a call. You can go find a navigator. We have some wonderful navigator organizations throughout Boston and the state. Those are people who do this all the time. So they know the ins and outs, not only of getting you through the application, but making sure you're getting the right plan, and getting you out the door with what you need. They're busy. They're going to be really busy next week.
So that's why you're saying get in this week before the rush, because a lot of people, for various reasons, at the last minute come in and they're trying to make the deadline. And so, Jason, I don't think has said before, I'm giving you special advice. Get in this week before, because then you'll get on the phone, you'll get frustrated, not want to wait, and then have to start over and go back in the queue. It was something.
Right. Yeah, I look at it. We did this, last month with our son. He's applying for colleges, and we were like, the deadline's the 15th. Why don't we wrap this up on the 12th or the 13th, just in case something happens and you have a day or two to, make sure you're all set. It's kind of the same thing here, right? Like the capacity for our call center and navigators to be able to give you all the help you need is going to get more and more limited as we get into next week and we get closer to the deadline. Everyone's motivated by a deadline. If your folks looked at the deadline as, let's say 11th, the 15th, and got things taken care of this week, they'd be able to say, and look, you can go in, you can apply, you can pick a plan, and you don't have to pay until the 23rd. If you want to hold off on going online and making a payment or writing a check until the 23rd, that's great. But if you can take care of everything else this week, you're going to be in far better shape.
Okay. Speaking of dates, one of the other things, I may have gotten ahead of myself. What is the special date around January 23rd? Is that because that is the you either have, what are the terms, Jason? Life changing. Oh God.
Yeah.
What is it called?
So if you don't, open enrollment runs through January 23rd.
Yes, sir.
The December 23rd deadline is to start the new year, right? Like,
yes,
you can get in, start the new year, you're all set.
Off healthy. Yep.
If you decide, to straggle a little bit longer and you want to wait until January, the deadline is January 23rd. After that, you need what we call a life change event.
Yes, that's it.
That could be you move to Massachusetts, on the 24th.
Okay.
You get married, you have a kid. There are a bunch of reasons why you can sign up outside of open enrollment. But really, this is the easy path, right?
Yes.
Like you do it now. No extra boxes to click. You just got to get the application done and pick a plan.
Okay. One of the other things I just thought about too, is I'm still looking at the screen, the navigators, the Health Connector has put a lot of investment in different languages to actually call. I'm going to, can you tell us about that? And I'll try to find the phone number, navigate to some of the enrollment places that you mentioned.
Yeah, so the navigators are community organizations that we work with. They can help you in person. They all do virtual appointments now. Also, if you can't get over to somewhere, you can give them a call, set up a time to, hop on a Zoom or whatever with them. But for the most part, our navigator organizations have been with us for a number of years. The people who provide this assistance, like I said, they do this all the time, every day, especially now during redebts. They've been super busy, over the last 6 months.
What are redebts, redeterminations?
The redetermination. Sorry. Yeah.
You're good.
And and they're like the nicest people in the world. They are so nice. We're actually, a couple folks are up today visiting, our Everett navigator, make the rounds a little bit, say hi to these guys, let people know that they're available. But, Boston Public Health Commission, Common Square Health Center, the Mass Alliance of Portuguese Speakers, they have a couple offices in Boston. They all have navigators there. And, the navigators, they make sure that the people who are helping have the ability to talk to folks in languages in their community, right?
Yes.
And
Spanish, that's not a
Portuguese,
barrier.
Haitian Creole. In particular, you get into maybe Quincy, you're going to have some Chinese speakers. We know that this process goes so much easier when people can speak the language they're most comfortable in.
Absolutely. That's why I was saying, like, Mass Health Connect has really done well at removing barriers for people to get the information, and also like coming in spaces like this and different other media outlets. One of the other things that we're going to talk about in general, just to review, there is now community care where a lot of the 1099ers, entrepreneurs, you're specializing in making sure certain populations know. But do you encourage any and everybody that needs health insurance to at least apply? Because more than likely, there's something, even if you got to pay a certain premium, whatever, there is at least something that can maybe be offered.
Yes. Obviously anybody can come in and get health insurance from us, even if you're making, $1 million a year. We have plans that are unsubsidized, right? You got to pay full freight, but they're available.
Okay.
But, more than ever, people have an opportunity to not just get help paying for their health insurance, but get that sizable help that we've been talking about a little bit. It makes it, you're getting to the point where, when people have to buy health insurance off the shelf themselves, especially if they're coming from, where they were in a job, getting insurance from their boss, people don't realize how much an employer pays, right? And they see the bill, they're like, holy cow, this wasn't that expensive. Well, it was always that expensive. You just weren't paying all of it. So with the new connector care, in particular, and with the new eligibility standards, giving more people access, people are going to see something that's probably a little bit closer in terms of cost compared to what they would be getting through employer-sponsored coverage. And if you're, a lot of people ditched, working for somebody else during COVID, right? They went out on their own. They're doing their own thing. They're doing great. Everyone needs health. Everyone should have health insurance, right? God forbid you get sick or hurt. If you get in a car accident, you go to the emergency room, right? Like, you don't want to get stuck with those giant bills. So you come into the health connector, you get signed up. Hopefully we can give you some help paying for coverage. And it's good for you. It's good for your, hopefully growing business. It's just it improves your lifestyle. Is really what it comes down to, having that coverage.
That piece, that's one of the reasons, like, I like having you in to talk about this, because you're very real about the fact, and we haven't even talked about the coverage includes behavioral health, to some extent, and the stress. We talked about the holidays. You don't want the anxiety of having a bill. You mentioned you save over $4,000, possibly for some folks with some plans. But there's more savings if you get the insurance. But if you don't, then you're back kind of on the other, what is the term? You're almost upside down because then you're getting stressed out. That influences your health. And it's kind of like, and so, we're not just here just because, I like talking to Jason. This is really real. We talk about, I'm serious because you talk about your style of life, but it's quality of life. That is your lifestyle is, come on.
Yeah, no. So yeah, you get into all that stuff that's sort of underneath, right? The fundamental decision of you wake up, you don't feel good, or you're really sick, or something really hurts, and you're like, I don't have health insurance. I'm gonna ride this out. And maybe it passes, but you're miserable for a couple 3 weeks, right? Like that's no way to live, where you're constantly, every time you're sick, you're like, oh man, I hope this isn't bad because I got to ride it out.
And you don't know. That's the other point.
In connector care, medication for diabetes, hypertension, some coronary diseases, zero copay. You don't have to pay for that medication, right? You have these chronic illnesses, you can come in to connector care and you don't have to worry about having to pay for that. Mental health and substance abuse services are covered. You just mentioned that, right? Like I think that we have seen a significant shift in how we think and talk about mental health in this country over the last 3 or 4 years. And I think people it's being destigmatized. People are talking about it more. People are embracing it more. But with health insurance and connector care, not only can you get the mental health services you need, but you don't have to worry about paying for it, right? Like alleviating that stress again.
It's interesting. And Miss Teresa from out in Worcester says, not to mention when we talk about the finances and the stress, not to mention, and we haven't talked about that. There's a penalty if you're not in.
Yes, there is. So if you don't have health insurance, you face a tax penalty at the end of the year. If you go the whole year without it, you're probably looking at well over $1,000 at this point. If you're in a connected care plan, you make the premium payments, you're probably covering, that tax penalty. And I think it's also important that people understand that by coming to the health connector, you're making sure you're avoiding, scam plans. If you went to Google right now and you put in cheap health insurance, there's a chance that you're going to see some scams out there, right? They're going to be plans that take your money. They don't really offer you coverage. You go to the doctor or you go to the ER.
They send a card and everything, Jason.
Oh yeah. And like, here's my health insurance. And they're like, no, this isn't covered. Here's a giant bill. Plus you don't have health insurance that meets state standards. So you have a tax penalty, right? Like you're getting it from all sides.
Yeah.
So you got to stay away from the junk. And the easiest way to make sure you're doing that is to, come to us.
Can we just stay there for a couple of seconds? Because I didn't, I get the potential spam and phone calls and whatnot. We have a lot of seniors that are in part of the Java Cafe. And so I just really want to be clear because often, I see my mom on Twitter and some others, and people will follow me and I'll go to look at their page and I'm like, you just joined this month. You got 1 follower and then you're following like 2,000. But my point is that don't click. In general, don't click on any and everything, but especially with insurance where you're putting your information, not only you can get scammed, but you could go get a whole bunch of service. Well, these days, some of the providers, they'll run the insurance before you come in. I have some admins in here in the medical space, but you don't want to just take the risk, period. Correct.
Yeah, they'll write your information down and then they'll go back when it's time, and they'll take the copay and they'll go back to bill you and they're like, oh, wait a minute, that x-ray wasn't covered. It's another $500, $750, whatever it is. So you're stuck with that bill. And then, come tax time, we're like, wait, you have junk health insurance that doesn't qualify. Now you got to pay the tax penalty too. So, scam avoidance is vital.
Yeah. It's good for you.
It's just get health insurance you can use, right? Like, we don't want people just to have health insurance. We want them to be able to use it, right? You're sick, go to the doctor. you're not feeling great, you want to talk to somebody, take advantage of the mental health services. You have diabetes, get signed up, take advantage of that $0 medication, right?
Yes,
Like
sir.
we want people to use their health insurance and be as active and healthy and lively as possible.
It's so interesting because those are the things that a lot of times that will prompt us to go to the doctor. But but let's also name that in certain with the right provider, they're also looking at you on a preventative and routine. You get your yearly exam for women, trans men. They get their breast exam, other exams that men need, and across the spectrum of the routine and preventative. That is, it's good to have it when you don't feel well, but it also covers everything in prevention, correct?
Yeah, yes, all that stuff, annual physicals, all the stuff that you need. Look, you go and get an oil change, right? For your car. Um, do the same thing for yourself. It's really what it comes down to, right? Um, get checked, make sure everything's okay, and keep going.
Okay. I some of the things that you just mentioned here. It's a little way away from insurance, but I'm just that thing with the scamming and insurance, and I'm just a little bit worried about my seniors, but we'll stay focused. We do want to make sure that we share the information and let you all know that where you can go to get more information. First of all, if you need any information about Mass Health, it is hyperlinked in the comments right now. And so you can go click there either under just Facebook link looks better. You can go there and click that. It's a hyperlink and you can get the information right there. Also, just for general information, you can go to the masshealthconnector.org. It is hyperlinked there as well. I think I did see one question before we go. Anissa is also, when she starts off with saying, listen, at every little headache, sore throat, shoulder pain, I'm at the doctor's office. I like how you said, like, be intentional about you're paying for it, so utilize it.
Right, exactly. Yeah,
Don't let it become a gym membership.
That's what it's. Yeah. And most of our carriers do pay you back for at least some portion of your gym membership.
Okay, I was joking, saying don't let your health insurance.
Yeah,
I'm a gym membership. I've been paying for mine, and I don't use.
Yeah, I'm sure you can get some of that back from your carrier,
even if I'm not going to the gym.
Hey, if you're paying for it, that's all they care about.
Jason, man, listen. I love when you come into the room. You're actually going to be back with us next month before I don't know if you knew it yet, but you're going to be back with us next month before the 23rd.
I'll clear my calendar.
Just to reiterate and make sure that folks know, and I love the fact that the Health Connector is very intentional about engaging of color media and in making sure the information is out there. Because one of the things that we first talked about was health equity, was awareness of information, and there's constantly new information. And so shout out to the state, Mass Health, the Mass Health Connector, for ensuring that folks get this information, and it's good information. I actually need to I'm probably going to go and just check, because being a 1099er, things fluctuate. So let me add, I'm going to be very transparent.
Yep.
My income fluctuated as and I spent some time on Mass Health not having on paper any income. You would encourage us folks to go and make sure that we need to switch or do some other things, or even eligible.
Yes. Yeah. Look, there's no harm in checking, right?
Okay.
You can come in, you can take a look. Hopefully it works out and it looks great. If it doesn't, yeah, obviously we still want you to sign up. And get covered. But the only way you're going to know for sure if you can get into connector care and take advantage of all the help paying for health insurance is if you apply or update your account and take a look.
Absolutely. I wanted
no better time than this week before it gets too busy.
I know, don't forget that reminder before it gets too busy and we all get caught up. Heidi said her question is, Heidi, if I didn't ask it before, I'm sorry. I did see it. My question is, if I'm losing my employer health insurance in February, do I need to sign up now? Will they, like in the app, take dates or give her an effective date? Or do you have to have, this is technically one of those change of life experiences.
Yes. So this would be considered losing employer sponsored coverage is is a reason to be able to sign up outside of open enrollment.
Okay.
If was Heidi,
Heidi,
right? Yeah.
yes.
If Heidi's insurance is ending at the end of January,
Yep. That's what it looks like.
she should sign up by January 23rd to start February 1st.
Okay.
If her employer coverage is running through February, she should make sure by February 23rd she's signed up for March 1st.
So let's just highlight and state that the month that you know that you will need coverage, you want to make sure that you were signed up. And if I heard you right, you may not even necessarily have to pay by the 23rd, or
you have to pay by the 23rd.
So sign up and pay by the 23rd of the month before you know you're either going to need insurance or have, if you know, having a change of life experience. The 23rd is typically the day, because you want the week for that payment to be processed, so the state knows that your payment is good and you can get effective coverage.
That's right. Look, there's a lot that happens behind the scenes. You pay us, we pay the carrier. The carrier does all their paperwork. They send the ID card out. That takes a few days to happen.
Okay, so all right, Jason, I appreciate you for coming in. I'm looking forward to next month. You're pretty soon we can just send you the link and you could just have some insured on here and you do it yourself. The Java
Sounds good.
Mass Health Connector, or Java with Jimmy on Mass Health Connector.
It's always good to talk to you, though. I really appreciate you having me back on.
Absolutely, I appreciate it too. And before we go, we just again want to make sure that folks have the resources and know where they can go to get. This is the general information for the Mass Health Connector right here. And also, if you want to go and talk with someone and ask some questions, you can both go to this link, and both of them are hypered to get you directly to the website. And so I appreciate you, brother. Please give everyone there my best. One other question: is dental covered too? Dental and eye care? Yes.
Yeah, so dental is separate. It is available. You can go online and you can buy dental coverage. That dental coverage is under $40 a month.
Okay. And I'm in the process now. I've been at the dentist for the past couple of weeks, and I'm honest, my smile is purchased.
Yeah.
I know Jason was like, wait, what? And so, to be very real, it without the proper insurance, that would be very interesting. And so dental, and what about eye care? I mean,
and we've heard from navigators, who are in health centers, and they say, when we see people come over to get the health insurance, is when they come in with a toothache. If it's a health center that has dental care, someone comes in and they're like, my mouth is killing me. You got to fix this. Like, mouth pain, dental, toothache is a whole nother level. That sometimes that's what, like these construction workers, right? They bang a nail through their finger and they brush it off, but they get a toothache and they're like, I need help.
Hey, oh my God, Jason, all of that is really real. And again, this is all authentic space. Yes, you get the proper toothache. Oh, Jesus. You were running to insured, you were running to doctors, nurses, physician assistants, medical assistants.
That's a much tougher one to wait out, right? We talked earlier about, I'm kind of sick. I might wait and see what happens. You have a toothache. You're not waiting very long.
You're online with an ice pack, type in and call it. No, and the fun of it and talk, it is really real, but maybe this will make someone be more at ease about just being real about the fact that you don't want to get to a point that you want to make a decision this week to go to masshealthconnector.org to sign up, even to ask questions to see if you're eligible, or if there's something, and Teresa, don't do that to your husband. Deidre's in as well. Is the dental insurance minimal coverage? Now, I can say before, I had options for my dental coverage when I had through Mass Health Connector before. And so Deidre, she's in she's a 1099er entrepreneur, self-employed in the cosmetology industry. And so that's something that, you can go, Deidre, go to the website and find out. Hi, sister. I love you. But the website, seriously, it has all the information. And I think I had two or three options to pick for my dental. I went in every month, and I think at that point was doing like the electronic check with a routing, and I had to pay online. I had health, and it was rated according to what they had as my income. And so it is pretty easy once you get set up. You just have to go online. I don't know, not to put you on the spot, but can you set up for automated?
Yes.
You can.
Yes.
Okay,
Oh, yes.
Awesome.
Yep.
So you can set up for automated payments, Deidre, and you won't even miss it. So, and I love you more. So listen, people, just so you know, people post link again. Hold on. People have said that good information and they're sharing it with their networks. Let me just get back because one of the mothers said post the link again. Yes, Pastor Marion. It's Mass Health Connector. This is the one to get the general information, and then this is the one to get the where you can get information about talking to the navigators. And there's actually an option on that page, Deidre, if you're there's some entrepreneurs in here with a couple of other employees. You do have the option to look at this as if you have 2 or 3 employees, you can actually, as an employer, go in and they can work with you for your offset, and then they would work with you to set up whatever you need to offer to your employees.
Yes. Health Connector for business, for small companies, they can come in and set up healthcare for their employees.
Okay.
It's a separate application, separate process, but at the end of the day, it's pretty similar where people are getting healthcare.
Okay.
And we have a lot of brokers. We do have trained brokers. If you go to the Health Connector for Business website, you can find someone, a local broker who can, kind of like a navigator.
Yeah.
They can help you out for free and get your company set up.
One quick question. This is more honest, personal for me. While I have you, I'm a single sole proprietor business. With what's now being offered, I just thought about this. Is it a decision of the individual to maybe go through the business end with one employee, or from your knowledge base?
So proprietors are on the individual side, on the health sector, not the business side. Correct.
All right. Yeah. So you have to have either 2 or more to kind of be eligible to look
yeah, it's
not to put you on the spot.
It could be one. Yeah, if it's me and some person who's not a spouse or family member.
Okay.
If I want to offer coverage to that person, I can do it through Health Connector for Business. Okay.
But sole proprietors should go through the individual.
Yes.
Okay.
Yeah, right. And that's where the really good help paying for coverage is also. It's a lot more help. A lot more help on that side.
Yeah. As an individual, they're not helping the businesses out that much. Cliff, we'll put the link back up, and then I got to get Jason out of here because I was only supposed to have him for half an hour. We're 11 minutes over, but this is good information. Cliff, take a screenshot of this right here. There is the Mass Health Connector. You can get that there. And I think that is it for me. Jason, we'll see you sometime a week in a few days before the 23rd to leave that little extra room that you encourage us to use.
Sounds good.
Yeah, because the week of the teens, it's going to be very busy, and that's the very last week for open season. So, and you looking like you need to get to a 9:30 late or something. So I'm gonna get you off of here.
No, I'm great.
Okay.
I'm good.
Right. Sure. I appreciate you, sir, for coming in and sharing this information. And we'll talk.
Sounds good. Thank you so much.
Teresa talking about I work for you, Jimmy. No, we don't offer health insurance. Jason, I'll talk to you, brother.
Hey, happy holidays.
Happy holidays.
Thank you so much.
And thank you. I appreciate it. And yes, happy holidays to you too. It's interesting to remember we are in that time of year, for holidays and whatnot. So salute to you and your family, however you celebrate. Thank you, brother. Thank you.
Thanks, you too. We'll see you.
Talk to you soon. Thank you.
All right. Bye-bye.
Listen, everyone, it is always a great time when I really like having that brother on. I just do. He's real. He shares the information, but he's you see him often going back and forth between just wanting to be Jason about the reality of the situation when it comes to folks in insurance. And then also he is, talking on behalf of Mass Health Connector. But a good balance of that. Y'all remember who you're talking to. I've had to find a lot of balance. All right. I'm getting off of here. I have to run to the post office. I just want to take a second and shout out Miss Teresa. I appreciate all that she does for not only the Java fam, but yesterday, and also let me get this up on screen here. Actually, the hoodie I'm wearing now, Miss Teresa made that for me. And so I just really appreciate her. I want to show you all something else that she helped me do. One I can show you, and one you have to wait because that's not going to happen until tomorrow. Let me see if I can just get this up here. to show you all that what we were able to do for our. Oh, I got to show y'all something else that's going to be fun. Well, yeah, I can do that. All right. Where is it? Where is it? Miss Teresa, thank you. And I just all of a sudden can't. Oh, this is all. I'm determined to find it today. Hold on. Where is Uncle Thaddeus? She also, here it is. She is also responsible for helping me celebrate some great folks from community. And one of them was Uncle Thaddeus. Y'all know who he is. And we were able to gift him something for Black Joy. And so here it is. I got to spend some time with him yesterday at Estella's, of course. And here it is.
Look at this. You know what I mean? I love this.
So shout out to Miss Teresa. Thank you for all that you do for folks in the Java Cafe. I really, really appreciate. She talked about I work for you. Speaking of that, we got some merch that's going to be available soon. We have Java with Jimmy ornaments. We have new Java with Jimmy mugs. There's a limited edition, and they're only 23 because it's 22 because I gotta have one. There's red, and I think there's white, black and white. And so those will be available for sale soon. They're going to be dropped. You can get the mugs through drop shipment. You just get that. Miss Teresa is going to create a link, and you can get those ordered. And also we have Java with Jimmy ornaments. I don't know if they're necessarily. I don't think those are going to go on sale. But we're going to figure out a way to get them to folks, so folks can come by. Maybe if I reach out, I'm not running around dropping them off. So we'll figure that out. One day there could be a meetup or something. I don't know. Just as a nice thank you to some folks. And so we'll figure all of that out. But the mugs will be available soon. We'll have pictures and everything and a link ready for you all to get them. And also go get your Java with Jimmy hoodie as well at javawithjimmy.com. All right, UCB members, you get an hour today. And I'm actually with them. I'm with UCB this week, one evening. So, all right, I'm off of here. I said that like a real Bostonian. Everybody have a wonderful day, and we will see you tomorrow morning at 9 a.m. Tomorrow morning, we are talking with, hold on. Tomorrow morning, we are sharing more information around fuel assistance and also rental assistance. We have an hour of information tomorrow at 9 a.m. We are speaking with the president of the ABCD and also the director of energy services. So we're going to talk about heating assistance, I believe some rental assistance as well. Also, just as a reminder for Waterfront Wednesday, which is the second Wednesday of every month. This is our last installment with our partnership with Boston Waterfront Coalition for 2023. We are continuing in 2024, and we'll get you updates about that. But Chris Cook from the Greenway is going to be with us on Wednesday. And then on Thursday, we're going to talk more about health equity with Kajaya Naidu and also Valerie Rucker-Bussey from the Institutes of Health over at Mass General Institutes of Health Professions. And so resources and information, as always, in the Java Cafe. Have a great day, everybody. We'll see you tomorrow morning at 9 a.m. Talk to you soon. Peace.